But what really surprised me is that certain groups in certain regions have a more problem with depression than others.
When you say regions, I mean, why?
Different areas. If you're in if you're like in a bigger town, in a bigger city, and there's more unemployment, or there's more poverty, or there's more, especially now with more job loss and people getting sick, and the crime rate's up, that depresses people because I know a lot of people that don't even want to go out of their house.
Right.
So when you don't go out of your house and you get tired of watching the news and you can only clean so much or you can only read so much, then you start getting in your head and you get depressed.
Right.
And then, did you know that women are more susceptible to depression than men?
I did not.
I didn't either. I didn't either. Women, the depression rate for female versus male, female is 8.2%, and the male is 5.3%.
Now, do you think it's because males don't admit it?
No, because women, a lot of it has to do with hormones. Now, this was, the research I did, this was taken back in 2017. Okay. I don't know if they've done it yet or not, but women deal with, postpartum depression, and then, you women have to deal with menopause. And that causes depression. Right. Men don't have to deal with that. So they said the biggest factor in that is hormones.
Right. I can see that.
But that really surprised me that it was like that. But then there's a lot of men that aren't going to, you're right, they're not going to admit, well, I'm not depressed. I don't have that issue. And when deep down they actually are. And it's okay to admit it because you want to get some kind of help for it. And I'm not saying run to the doctor and get medicine because it's not always the answer. If you're depressed, kind of change your routine up. Start going to the gym or start walking or doing something productive instead of just going to work and then going home, sitting on the couch in front of the TV or doing whatever. Now, with you women, it's hard to control the hormones. I mean, but I think, and you could answer this, I think by staying active. Yes. And trying to stay productive in a healthy manner can help with that depression.
Yes, absolutely. And sometimes you gotta force yourself.
Right. And us men have to do it too, because there's days where there's days I don't want to go work out, or I'm having one of my moments because of my mind just goes crazy, and sometimes I have to force myself. Okay, you're gonna go do this and you're gonna go do that because I don't want to isolate. I don't want to sit back. But then you throw in the fact of, okay, if somebody's got social anxiety and they have an issue going to the gym at a certain time because there's so many people there, or they don't want to be around crowds, I have some friends and people that I talk to spread out. They don't want to go into public at all. They really don't want to be around big crowds. So, in a case like that, if you're dealing with some anxiety or depression and you want to get out, go to a park, go for a walk. You can find a trail where there's not many people around. Or just walk down the street in your city or wherever, go to the track, do something.
Yeah.
I've never had social anxiety. I'll talk to a wall, but these are some serious things because I'm seeing that it's leading to harder stuff, where I'm seeing people not dealing with it correctly, and it's leading back to the drugs and back to the alcohol. I've seen it lead back to to suicides, because people sometimes pride and ego gets in the way. Even with women, I know women that will let that pride, I'm supposed to be the strong one, so they let that get, and it's okay not to be okay like that sometimes, and it's okay to get the help. And on the suicide, that number surprised me. 800,000 people a year die from suicides.
And I'm sure it's higher
Now,
this year.
Well, this was back in 2017.
So yeah, I'm sure it's going to be much higher this year.
So back then, every 40 seconds, somebody was dying of a suicide.
Wow.
Because they don't know, they're at their end of the rope. They feel like they have nothing left to give, or they have nowhere to go. But suicide's not the answer. Suicide's not the answer. And I've seen people that have a mental illness that are taking medicine, and they get to feeling good, and they don't realize it's their medicine that's making them feel good, or don't want to think about it, or maybe, well, I can do this on my own, so they stop. And they stop taking their medicine, and then they get into just a tailspin.
Correct.
And sometimes that leads to suicide because they think they can't deal with it anymore, when in all actuality, if you're on taking medicine for bipolar, paranoid schizophrenia, whatever it is, you need to stay on it, because if that's making you feel good, don't stop.
And actually, a lot of those psych meds like that, you have to be weaned off of it. So when you're not if you just stop cold turkey, I mean, that puts your body in kind of a shock, which your brain,
Well, the benzos will kill you. Benzos is one of those to where if you take any type of benzos for a long period of time and you just do cold turkey, that can kill you. It's the benzos and the alcohol are the only two detoxes that if you're going to detox off of them, you need to have medical help, because it'll cause you to have seizures. And I knew somebody that was detoxing off of benzos and alcohol, of course. Second day in the hospital, got done eating, was laying down, had a seizure when nobody was around, swallowed his tongue and died in the hospital.
Oh, that's, wow.
So if that happened in the hospital, imagine it's happening a lot, especially with COVID now, because there's so many people that are isolating, and so many people that just don't want to, they want to be left alone, or they're afraid to reach out, because, and especially, now with a lot of these doctors, maybe not so much in our area, but in other areas, the only time you can see the doctor, even for mental illness, is through video.
Correct.
And you got to be open and honest with the doctor, because it's through a video. If you were in a doctor's office, he could tell if you're trying to put a fast one or lie, whereas on a video you could probably hide it a little better.
But hopefully if you're wanting to help, you're not hiding anything. So.
Exactly.
Hey, let's talk about, we're talking about mental illness. Name some mental illnesses. I know you said anxiety and...
You got the ones that I'm familiar with.
Okay.
You got anxiety, depression, you got the social anxiety, social disorder, whatever, bipolar, you got paranoia, schizophrenia. Those to me that are the common ones.
Well, they consider ADHD and ADD.
And PTSD is another one.
Correct.
You could call it. What else?
Personality disorder, borderline personality disorder is another mental illness, and dissociative identity disorder, and that is what I want to talk to you about.
Yes.
And everybody else. So, have you ever read a book and totally kind of spaced out and don't even know what you read?
A long time ago. It's my problem when it comes to reading. A lot of times I don't. my concentration level doesn't stay focused enough, and then I'll have to stop and go back and read it. But there has been times where I'll be reading something and I'll try to remember what I read, and it's like, okay, what did I just read? So yeah, it's I totally forgot.
Yeah. What about, like, have you ever been, like, driving on a familiar area and kind of just, like, was focused off of something, like, you didn't even know where you knew where you're going, but you don't remember that how you got there?
Oh yeah, been there, done that.
Okay.
It's been a minute, but yeah.
So that is sort of what dissociated identity disorder is, what it does to us. So I have been diagnosed that. Not too many people know that, because I think I've handled it very well over the years.
Right.
But actually was diagnosed this past year when I went through all my therapy and was working through all my demons and traumas and situations in my life. So so the only difference in it is that it kind of takes over us. As for someone who doesn't have it, it's just a moment. For us, it's these personalities. And so the thing about it, what I've been learning is that I have these personalities, but I didn't know I had these personalities. Because again, it's something that I've always can remember. And so I never thought nothing of it. But I've always had people tease me, like, okay, so what personality are we dealing with today? And I would be like, I'd laugh it off, because it's like, well, whatever.
Right,
you know? I'm not really taking it serious and not really realizing it was an issue. So this past year, I'm learning that I have these personalities. And so we talked about me turning the light switch off.
Right.
And we've talked about me being forgetful. And I don't know if we really talked on here about me being forgetful, but I know personally we've talked about me being forgetful. So
and we're doing that now.
Right. So I know in my past, I'd always forget things. And I would always blame it on my car accident that I had when I was 17, having a traumatic brain injury and this amnesia, and that's how I can't remember. But then it got started getting really bad, and so I used to go to the doctor and get CAT scans done, MRIs done, trying to figure out what's wrong with me, why can't I remember things. And, eventually a doctor was like, well, your brain can only take so much information, you're fine, or whatever. Well, it turns out this past year, those are my personalities. Because of the trauma that I have dealt with, and so the abbreviation is DID. And so the trauma that I've dealt with as a child, these personalities will make a personality will come out, and it will be that personality, but later I won't remember that because it was that personality, and I'm in a different personality now. And I've been more subconscious about it now that I've been learning about it, because I actually went to Celebrate Recovery a couple weeks ago, and when I was in the little group and they asked how our week was, I was like, oh, my week's been great, da 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 da. And I acted like the world was great, and COVID's not bothering me, nothing's bothering me. To literally listen to everybody, that I actually interrupted them and said, listen, I had to take back what I said, because that was a different personality. So that personality that was telling you that my life has been great and everything's great, the truth is my anxiety's been up. So here's a different personality of me. Does that make sense, what I'm saying? But because I've dealt with this pretty much most of my life and didn't know about it, I'm not going to say I'm an expert on it, but I've been able to control it a little bit better than most people who has known about it.
So how do you control it?
What?
What do you?
Well, I don't really control it, I guess. That's not really.
I mean, how do you deal with it, and what steps do you take?
Well, it's not even really dealing with it. It's when I recognize it. Like, I recognize that person, and like I wrote it down here. Like I call it. I have a post-traumatic Lisa.
Right.
And that's usually my moments where something triggers me, and then I'm this person. I'm in defense mode. I'm in protective mode. I'm in whatever modes. You know,
right.
I just know. And then there's the I call the disassociative Lisa, which means I am all over the place, and I can't really tell you who I am. I'm just all over the place.
Right.
And then there's the normal Lisa, whatever normal means.
I don't think anybody's normal.
But I posted it. I'm saying it's the normal Lisa.
Right.
But I have had. I've had people very close to me say there's this, because some people think having this disorder, it's like you could be dangerous, and it's kind of like I wouldn't say we're dangerous at all. Even though people tell me they feel like I could snap any minute and I could easily hurt somebody and walk away like a light switch.
Just shut it off. See you later. Have a good. Yeah.
And learning about this disorder, I probably could. But the thing about this disorder is we don't really want to hurt people, because we've already been hurt.
Right.
Not saying we won't hurt people, because of there could be that dissociative Lisa personality might come out that could hurt somebody, but we normally don't want to hurt people.
Right.
Because we've been through that. It's actually a very interesting. And I'm still learning to learn myself.
And I wrote the DID down, so what I'm gonna
go research it.
I'm gonna research it because I want to know more. Now, we have talked quite a bit, and over the past year since you worked on all your demons, and you've kind of faced some things that for so long were buried, you didn't want to touch.
Correct.
And in some of our, and I won't go into deep, but some of our personal talks, you've said that now you want things on a more, I guess, personal and an intimate level as far as your feelings, which you've never had before.
Right.
You've never, it's like, and guys, I'm telling you, when she says she can hit the light switch, I've seen it numerous times, and it's like, wow, okay. And I'm assuming that is when the feelings do come out, and this is all new to you, that is the normal Lisa. That is like you're normal, and it's not like you're not like all over the place, or does it kind of, are you like all over the place with your feelings, and I want this, and I want this, and I want this, and you got to go, well, wait a minute.
Oh, that's the dissociative Lisa, because I am all over the place. I want this, and I want this, and I want this, and I want this, because I'm really confused. I do want something, but I'm trying to put it together, so I'm verbally speaking it out, trying to figure out who I am and what I want. So that becomes a very confusing, not for just me, but everybody who's around me, because they're just like, wait a minute, you just said this, and now you're wanting this, and so, no, that's the dissociative Lisa.
Because we've talked about that, and you said you want this, but then these people are saying, but you already said you wanted this, so trying to get the two to,
That's the disassociative Lisa who doesn't know. I mean,
you're just trying to kind of feel your way through it and figure out what you right.
Correct. And
Gotcha.
to be honest with you, in a probably a day timing or a week timing, I probably wouldn't even remember that conversation anymore because that was that dissociative Lisa,
right.
And that was just the moment.
Gotcha. And then, since I've gotten into recovery and I talked to so many people, prior to when, and this is where I'm glad that the whole stigma on mental illness is changing because so many people are dealing with it. Prior to me getting clean and learning, when you heard about somebody having multiple personalities, you would automatically, well, they're messed up and they must be on drugs and blah, 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 and you would joke around about it.
Right.
And I think a lot of times people joke around about it because they don't know how to handle it and they don't know what to say or how to deal with it. I could be wrong, but I think that's just a kind of like I don't know what to say, so I'm just going to throw a joke out.
Correct. And they're not educated.
Right. I mean, they don't know.
Because, again, you've never even heard of DID, I guess, right?
No.
So, it's, a lot of people use borderline personality disorder or multiple personality disorders, or they use all these different things. But, but if you're not educated on it, you really don't know. So you do say that joke, or you do because what else are you going to say? And the truth is, until this past year, I would have denied it. I mean, whatever. There's nothing wrong with me. I used to always say nothing was wrong with me. But I'm starting to be able to really click it. I mean, even over the years, probably the last 7 years, I could say that I did not know that was my diagnosis, but I could start pinpointing things like something's wrong. I'm depressed.
Right.
The thing is my depression never really lasted. That was the dissociated Lisa over here. My depression usually never lasted very long, a couple of days maybe, if that, because then I already did something in my addiction world that got me excited. So I didn't
get away from that.
Yes. So that's the thing with mental illness, and then with addiction, you really start. I mean, it's a wham, bam, collision kind of a thing, because I mean, when I look at some of the people with mental illnesses, they are in some kind of addiction or have been in some kind of addiction. And it's really to get them out of that. I mean, so let's talk about bipolar. A lot of bipolar people, I've talked to people that are bipolar, they're on their medications, but they're still not feeling, because they've been on so many different kinds of medications, they're not feeling good. But all of a sudden they took that whatever drug that gave them that wonderful high, that gave them a different feeling than the actual prescription.
Right, so that's why they want to run with it.
They run, correct.
And I've seen people since I've been in recovery that have been diagnosed with bipolar or borderline paranoid schizophrenia, and then get high, and it takes it to a whole new level of their paranoia, whole new level. So that the biggest thing is the mental illness is. It's nothing to be ashamed about, and if you're having issues, it's time to get it taken care of. It's whether it be going to the emergency room if you're in your thoughts and you're wanting to kill yourself, or you wanting to do this. And the number for the suicide is 1-800-SUICIDE.
So when you say you go to the hospital or go wherever, I was reading on a message from someone that messaged me on the way here, and they're like, it's easy for everybody to say go get help, but when you have no insurance, nobody wants to take you. And mental illness is one big thing. there are a lot of places you can't go without some kind of insurance.
If you go into the hospital and you are suicidal,
I'm talking about suicidal, just mental illness.
But okay, we'll go to that. If you're suicidal and you tell them at the hospital, they have to keep you for
absolutely.
With mental illness, there's some hospitals that have most hospitals have a psych ward.
They do.
And you can go in there. You're supposed to be able to, but now with COVID, it's a whole. They're not taking as many patients, but you should be able to walk in and say, "Look, I need some help, and I need some help now. I'm not here for any narcotics. I'm not here for a high. I need some help," and they could give you, like out here in St. Charles, Volunteers of Medicine, and there's got to be places like that elsewhere. You can go to Volunteers of Medicine with no insurance, and they can direct you to doctors that can help you out.
Are they open 24/7?
They're not open 24/7.
So let's back up just a little bit. When you were saying going to hospitals, I'm going to say in St. Louis, in St. Charles, there's not one hospital that will take you unless you're suicidal to go to the psych ward, and I know that for a fact. I have taken multiple people to the hospital, and they will turn you away because they're not harming you and they're not harming themselves. So that I want to do a correction. Maybe in other states they will, but in St. Louis, Missouri, and St. Charles, Missouri, they will not unless you are actually harming yourself or someone else. I know here locally, Kreider is a good one that you can go to, but again, without insurance, they do a scale at Kreider. I don't know where the volunteer. What did you call it?
Volunteers of Medicine it's in St. Charles, and I believe it's off of it's either Cave Springs or Mexico.
But where does these people go when it's evening time, when these places are closed? Because
if the hospitals won't take them, there's nowhere. They're going to have to call somebody in their support system. Everybody needs to have a support system. It's because if a hospital won't take you, a family member, a friend, a loved one, if it's to the point where you can't deal with it, call the paramedics and say, "Look, I need somebody to talk to." Call a policeman; they'll come talk to you. And because I've seen police officers go out to respond to somebody that's having a mental health issue, and they will talk to them, and they'll even have the paramedics come out if they think it's dangerous enough, and get them and kind of direct to get the help they need. But the big thing is everybody needs a support system.
Yeah. I wrote on my paper, sorry, I'm just reading it while you were talking, and this is true here. I said, how would you handle looking in the mirror and not recognizing yourself?
Oh, I did that for years.
And I want everybody else to think about that too. How would you handle looking in the mirror and not recognize yourself? And I wrote, I've grown to accept it, but didn't know all this was a mental illness, because I look in the mirror often, and I'm not sure who I'm looking at.
Because
what personality is it?
Right. And see, I can't say I understand because I don't have that. I don't have that.
And that's always been my norm. I didn't know it was a mental illness. I did not know a mental disorder or whatever you want to call it. That was my norm.
Right.
So, from people who has known me for whatever, that dissociative Lisa over here is also feels like she's this person. So when we say disassociative Lisa, there's multiple personalities in that dissociative Lisa that I can't even pinpoint yet every one of them.
Right.
So I can't tell you how many. I mean, they say eventually I'll start being able to pinpoint, but right now I'm not able to pinpoint how many there are. But there's the one where I'm a girl. I'm a little girl. And then I know there's one that I'm a pregnant woman. And then there's the one, and so let me go back. So like the pregnant one, that's usually by the time I start overeating because I want my belly to be big, so I'm pregnant.
Right.
And not realizing that's that personality thing. And then I've already gained all this weight, so now I need to go lose all this weight. So my weight fluctuates all the time because it depends on that personality and how long I'm stuck in that personality, or I may get out of it, but then I go right back to that personality. Then you, so I'm still learning the different personalities, but learning through all my the therapies that I've been going through and stuff like that. All this really stemmed from me being sexually abused, beaten by my adopted father, and sexually abused, molested, or whatever you want to say, by my brother and by my neighbor, and then it just continued to go on. That's how did disorder actually. I mean, that's how it develops in you, because you need your safe person, which is your little girl, innocent little girl, right, who's trying to be safe. So it goes back to that light switch. When I think I'm in harm, or I'm in danger, or it's something I don't want, that light switch goes off.
Protective mode. And I was fixing to ask you if that stemmed from all the abuse growing up.
That's what I'm learning.
Right.
So, I mean, I know we giggled a few times in some of the past shows here about my light switch. And I already knew in my head about this conversation, but I didn't want to let it out yet. But, right. But yeah. So that's how it goes. That light switch gets turned off. Because you asked me how do you do it, or how you control it, or I can't remember your question anymore. But you asked me something about my light switch.
Well, yeah, because I wanted to, because it was just like when something got to you, affected you, it's like you had no feelings. It's like you were just like, it's like it never happened. It was never said, nothing. I mean, it was just like, okay, and it's like most people wouldn't be able to do that. I mean, right. I've seen it. I'm going, what the hell just happened? But so now that makes sense. I gotcha. But I'm definitely going to do more research on that.
So I've already gained all this weight. Now I need to go lose all this weight. So the mental illnesses, I mean, there's multiples out there of different ones, and I wanted to share mine, especially because a lot of people don't know about it, and I don't like freely open about it, but people that know me have seen different personalities, and I want other people out there to know that they're not alone either. I mean, whatever your mental illness is, between anxiety, depression, bipolar, paranoia, ADHD, ADD, you're not alone. And I think we all have something.
Oh, yeah.
And we gotta get out there and be open about it and talk about it. And if you don't know about it, like someone comes to you about it, go do your research.
Right.
Because you'll be amazed. I mean, you talked about how people joke about the personality thing, or joke to somebody when they say things and not take it serious, but that could be a trigger to somebody also.
Right. Oh, absolutely.
And so things like that, I think it's important.
And what's that saying? You don't know if you don't know? Is it
You don't know that you don't know if you don't know that you don't know it.
Right. It,
I haven't said that in a while.
Yeah, it's been a minute. Yeah, it's been a minute. It and the biggest thing is if you're on if you have medication to take for your mental illness and it's working, don't think you can do it by yourself, because it's the medicine that's helping. And don't stop and keep taking it. And that's the biggest thing I've seen with people fall back, is they stop taking it because they're feeling better. And I get it. Everybody, I wouldn't want to take medicine all the time. I would get tired of putting pills in my body every day. But if it's going to help your mental state, then you got to do what's going to be able to keep you. I'm not going to say sane, because I don't think any of us are sane. We're all.
That
but if it's gonna,
Lisa over here says yes, we are.
If it's going to keep you like mentally balanced to where you can function, and you're not. Because I know people get off the medicine and they start hearing voices, and they start saying things.
But do you understand now, for DIDs, personality disorders, and different things like that, there are no medication.
Right. So with that, the fact that you're starting to recognize it, and you're starting to not only recognize but identify. That is the big thing. Now that you're identifying, okay, this is this Lisa and this is this Lisa, then the more you learn, and the more now that you're aware of it, you can deal with it better, because you'll be able to handle it. Okay, this Lisa's coming out. Well, let's put the light switch down. Let's go back here.
Yeah, and there's therapy. So if there's no medication, there's therapy that will help, and that is what has helped me a whole lot to start identifying things and not be off over here. But so I know we got about 15 more minutes, and we're talking about, you keep bringing up medication. Let's talk about our young kids. And doctors immediately diagnosing them and putting them on medications. And if that medication doesn't work, because as we know, everybody's body's different.
Right.
And so what works for one person may not work for another. So they play around with different kinds of medications until they find one that's tolerable or whatever. But what if they got that misdiagnosis? What if, where does parents finally say stop? And I'm gonna continue talking here, and I'm gonna let you talk, but I'm gonna go back to being 23 years old with a 2.5-year-old, and the doctor saying she's ADHD, and me saying, how do you know? You just walked into the room. Well, we've been watching. She goes to this toy, she goes to this toy, she goes to this toy, she goes to this toy. She doesn't stick with one thing. She's ADHD. Oh, okay. If I'm not knowledgeable, I'm 23 years old, I'm still a kid.
Right.
Honestly. You're taking a professional expert's word, and then I'm a big Googler, researcher, so she gives her Ritalin, so I'm going to go research what Ritalin is. What are the side effects? Not what it is. What are the side effects? Oh my goodness, she's not breathing. Oh my goodness. And of course, she was breathing. She was doing everything.
Right.
I just wasn't used to her doing nothing. And then you got used to her doing nothing, that you're like, oh, that's what a kid's supposed to do? Nothing. Oh, okay. Again, being 23 years old.
And not knowing anything.
I wasn't raised with a family. I wasn't raised to know anything, so I am just learning as I go. And then all of a sudden, she's back to the child I remember bouncing off the walls. People saying, hey, I want you to come have lunch with us or have dinner with us, but can you find someone to watch your kid? What? Yeah, because she's just so distracting. And then over the years keep putting her on different kinds of medications to, and studies now say Ritalin is just like a form of cocaine. Am I right?
I used to do Ritalin just because, so yeah.
Okay, so we're saying we're giving a 2.5-year-old Ritalin, cocaine, whatever, at 2.5 years old.
And I'm not a doctor by any means, but I think that's where a big problem starts. Now, when I say if you're on medication, keep taking it, I'm not talking about at a teenage, or I'm talking to adults that are older that have been fighting it. Now, what I do not agree with is these doctors that will put a 2-year-old and say that they're ADHD. Okay, because she's bouncing from this toy, bouncing. It's called learning an imagination, wanting to check it out. And that's the problem with this world, in my opinion, because these pharmaceuticals push these doctors to push the medicines out. And now Ritalin is, from what I understand, if they're hyperactive, they do Ritalin and it calms them down.
Correct.
Now, if they're calm,
Ritalin
and you give
them up.
It gives them more energy. Mm-hmm. Okay, why not let kids be kids? If they want to experiment, okay, they want to look at 10 different toys. It doesn't mean they can't focus on one. They're 2. Their brain is trying to figure things out.
They're learning.
So I don't agree with any of that. And even at a teenager, I don't agree with. Let them. Now, there's going to be some cases where there's just some. I've seen it years ago where there's been some teenagers that were just, whether it be their mom and dad were on drugs when they were conceived, and it caused their brain to go, and they needed some type of medicine to keep them from going like too crazy.
Yeah,
I've seen cases like that.
But we're talking about like
little babies. No,
yeah, and growing up and just constantly, like at 7 years old, they decided that she was not only ADHD, she was bipolar.
How are you going to know that at 7 years old? That goes back to the pharmaceutical companies pushing the doctors to put medicine out, and that is the biggest reason for people to be in addiction, because it's the pharmaceutical companies and the doctors, and it's a money thing. Now, I'm not saying all doctors are like that, and because there is a lot of good doctors, but I can tell you from 87 on, I could go to the doctor and say I broke a toenail, and I could have a prescription of 120 Oxycontin or 120.
Correct.
So it's 2 years old. If a doctor's saying your kid is ADHD, I would get more opinions, because your kid is just trying to have an imagination, trying to figure out what's that, and you're taking that imagination away from the kid by putting them in medicine at 2 years old.
Now, when she got older as a teen, we went and had her tested multiple times with different doctors, because I kept saying, are you sure? Are you sure? Are you sure with this diagnosis? But as soon as you walk into another doctor and say, well, we were seeing this doctor, and this doctor said she's this and this, they automatically would be like, yep, that's what she is.
Oh, yeah, because it's against the doctor's code.
So we never could have gotten, until, of course, she becomes an adult at 18, even though they're still kids, an adult at 18, to say, oh, yeah, we have misdiagnosed her for 16 years.
Well, imagine that.
But guess what now? My child is in addiction, because she's looking for that high. She's looking for that thing to calm her down. She's looking for that, because we have poked down medicine down her throat all this time. Now she's looking for all these pills, because that's what she knows. Pills fix it.
Since she was 2 years old, and she never should have been on it. So the parents need to do more research, and I hope now with the opioid epidemic and so many overdoses, and parents are starting to realize that the pharmaceutical companies are bad. because they are the ones that are pushing. They're pushing the pills. And finally, now that there's so many overdoses and they're trying to change the laws, it's harder to go to your doctor to get pain pills. A lot of the times. But I do know people that still get their...
I don't know about that. I mean, the dentist really... I remember having a tooth pulled and they gave it to me just like that, and I didn't even take them.
But there's some doctors out there that if it's in your records that you're in recovery, they will give you a very mild, but then there's some that still throw them out, and they shouldn't.
Yeah.
So it's just a big... You get me started on the pharmaceuticals and then pushing the pills out, and I get... Because that is the biggest reason why there's so many people on... that are addicted to heroin, because it starts with pain pills. That's where it all starts. A majority of the people start on pain pills. I know a guy that a couple years ago, he was doing good, and I'm not going to say his name, but he was doing good, and he had to have some teeth pulled, and the doctor knew he was in recovery but gave him some pain pills, and he ran out of pain pills. His body needed that. His mind needed it. Got some heroin and died. And he just graduated drug court.
Oh, wow.
Now, it was his choice to take the pain pills to begin with. But that's a whole nother story right there. So
Right.
You get me going on that. My passion and
So, big advice today really is what?
If you're struggling with anything we talked about, any mental illness, you've got to reach out. You have to. It whether it be a family member, a friend, somebody, everybody has their phone. Everybody has this in their hands nowadays. So you can reach out to somebody. If you're depressed, if you want to kill yourself, like I said, the suicide number, I think 1-800-SUICIDE. It's 24 hours. Mm-hmm. It during the day.
273-8255.
There you go. It but you can reach out to a church. You can call the police. You can call a hospital. If you're dealing with just having a bipolar or paranoia, call somebody in your support network that will sit there and talk to you. And then the next day during business hours, if you are on medicine, call your doctor and say, look, we got to adjust something that's not working. Because there's some people that just have to take the medicine.
Correct.
And the doctor will get it. They'll experiment and get it figured out to where you could actually not be crazy in your head all the time thinking people are going to kill you or you're hearing voices. So it's just a matter of picking the phone and reaching out.
And learn about mental illness. Learn about it. If you don't think you have anything going on, please learn about it if you hear about it from people around you, so you're educated on it.
I'm getting educated on all of it because I deal with so many people that have it. I want to learn more to where I can't say I understand, but I get it, I guess, because
Calls from.
All right. So, we're going to end today, but I want to let you know next week we are going to have Heather come on. She will be talking about her addiction. She normal kid, but started doing meth at 11. Started doing heroin at 14, and she would overdose on a regular basis. And she has children, and she is clean, and she is going to tell her story. And so we would like y'all to listen in next week. We will be here at 4:30. And invite your other people to listen in too.
Absolutely.
So thank you for listening. We will be here next Thursday at 4:30. Y'all have a great week.
Yeah, everybody have an awesome week. And if you've got any questions, just feel free to comment or message us or reach out to somebody. But get the help you need because it's definitely worth it.
How do they reach out to you?
They can message us through Facebook. They can get on my page. It's Scott Hartman. My phone is with me all the time. I check my messages constantly. everybody knows my phone number. It's 636-578-0978. I mean, it's all over social media. So if you need to talk or if you need resources, whether it be treatment or anything else, please call me, and I will help any way I can.
And same with me. It's Lisa A. Mash on Facebook. My phone number is 636-582-0334. Call me, text me, either way. I think Scott and I here both will agree that we will do what we can to help you.
Absolutely. Absolutely.
All right, guys. We'll see you next week.
All right, thanks. Have a good week.
Hi, I'm Lisa Mash, the uniquely unforgettable coach, and this is Scott Hartman, who's the I Get It coach.
And we are recovering addicts that have dealt with the mental illness, the homelessness, the rape, and we're just out to try to give hope and resources to people that don't know where to turn.
So we are going to be hosting a radio show called Voice of Hope, and it is going to be on the Ferguson USA Hot Talk Radio on Thursdays starting July 16th at 4:30 p.m. Central Standard Time. This is pretty exciting for us. It's new.
We just want to give hope because there's a lot of people out there right now that feel hopeless, feel they don't have any resources, don't know where to turn, maybe feel alone. So if you're a family member that is dealing with the addiction, or if you're in addiction yourself, stay tuned because you're going to get a lot of resources, you're going to get a lot of hope, there's going to be some real talk, and I think this is going to be an amazing thing, and it's going to help. So, stay tuned. We got details coming up, and I hope everybody has a blessed day.
Yes, remember, real talk, real people, real issues. See you soon. Hi, I'm Lisa Mash, the uniquely unforgettable coach, and this is Scott Hartman, who's the I Get It coach.
And we are recovering addicts that have dealt with the mental illness, the homelessness, the rape, and we're just out to try to give hope and resources to people that don't know where to turn.
So we are going to be hosting a radio show called Voice of Hope, and it is going to be on the Ferguson USA Hot Talk Radio on Thursdays starting July 16th at 4:30 p.m. Central Standard Time. This is pretty exciting for us. It's new.
We just want to give hope because there's a lot of people out there right now that feel hopeless, feel they don't have any resources, don't know where to turn, maybe feel alone. So if you're a family member that is dealing with the addiction, or if you're in addiction yourself, stay tuned because you're going to get a lot of resources, you're going to get a lot of hope, there's going to be some real talk, and I think this is going to be an amazing thing, and it's going to help. So, stay tuned. We got details coming up, and I hope everybody has a blessed day.
Yes, remember, real talk, real people, real issues. See you soon. Hi, I'm Lisa Mash, the uniquely unforgettable coach, and this is Scott Hartman, who's the I Get It coach.
And we are recovering addicts that have dealt with the mental illness, the homelessness, the rape, and we're just out to try to give hope and resources to people that don't know where to turn.
So we are going to be